We tend to celebrate the heart, marvel at the brain, but how often do we really think about the liver?
Probably not often enough.
Yeah.
Yeah.
It's so much more than just a filter. It's absolutely fundamental to keeping you running smoothly. Think about it. It's constantly working behind the scenes.
Absolutely. It's an organ that manages, well, an astonishing array of tasks simultaneously, from processing every bit of food and drink you consume to playing a crucial role in your immune system and, ensuring your blood can clot. It truly is the central hub for so many bodily functions.
Right. So, for this deep dive, we're venturing into the critical area of liver health. We're going to explore what happens when this incredible organ becomes inflamed, that's hepatitis, and what can occur when this inflammation leads to more severe, irreversible damage, which we know as cirrhosis. We've got some really informative material that breaks down all the essential aspects, and we're here to extract the most valuable insights for you.
Our goal today is to provide you with a crystal clear understanding of your liver's vital roles, the different forms of hepatitis, the progression to cirrhosis, and the key indicators and potential complications along the way.
Okay.
We want to empower you with this knowledge in a way that's, engaging and easy to grasp without overwhelming you with detail.
Fantastic. Let's dive right into what the liver actually does for us on a daily basis. It's not just one or two jobs, is it?
Not at all. Our source material highlights 4 key areas of responsibility. First, the liver is a major metabolic center.
Okay.
When you eat carbohydrates, it plays a vital role in regulating your blood sugar by storing glucose as glycogen. That's glycogenesis, essentially creating a reserve.
Like a battery backup?
Kind of, yeah.
Yeah.
Then, when your body needs energy, it breaks that glycogen back down into glucose, glycogenolysis. It's constantly working to keep your energy levels stable throughout the day.
So it's like a sophisticated energy management system.
Yeah.
What about how it deals with proteins and fats?
Yes, exactly. Regarding proteins, the liver produces essential components like albumin,
Albumin, right?
which acts like tiny sponges in your bloodstream to help maintain the right balance of fluid. It also synthesizes clotting factors, which are critical for preventing excessive bleeding.
Okay.
Furthermore, it handles the breakdown of amino acids, converting the toxic ammonia produced into urea, which your kidneys then eliminate.
Right. Gets rid of the waste.
Precisely. And when it comes to fats, the liver is responsible for producing cholesterol and those incredibly important bile acids, which we'll discuss in a moment.
Okay, so it's not just processing what we eat, but also producing vital substances. What's the second major function?
Detoxification and excretion. Think of the liver as your body's primary purification plant.
Good analogy.
It's continuously filtering your blood, removing toxins, drugs, alcohol. A crucial part of this process is how it handles bilirubin.
Bilirubin, that sounds familiar.
Yeah, it's this yellow pigment, a byproduct of the breakdown of old red blood cells. The liver transforms it into a water-soluble form so it can be excreted in bile.
Bile. Okay, so that leads us to the third core function, right? And I recall reading that the color of our stool is actually linked to this process.
You're absolutely right. The liver produces bile, and the bile salts within it are essential for breaking down fats during digestion. Essentially, they act like detergents to emulsify fats.
Break them up.
Exactly, into smaller droplets that your body can absorb. And yes, the bilirubin that's excreted in bile is what gives your stool its characteristic color. Interestingly, changes in stool color can sometimes be an early indicator that something might be, amiss with your liver or bile ducts.
Huh. Really?
Yeah, it's quite remarkable how something we might not often think about can actually provide clues about our liver health.
It really is. Okay, and the fourth key role?
That's the liver's involvement in immunity and coagulation. It houses specialized immune cells called Kupffer cells.
Kupffer cells.
Yes, Kupffer. They act as the first line of defense, removing bacteria, viruses, and other harmful substances from the blood as it circulates through the liver.
Wow, like security guards.
Sort of.
Yeah.
And as we touched on earlier with protein metabolism, it's also responsible for synthesizing those critical clotting factors like fibrinogen and prothrombin.
Right, the things that stop bleeding.
Exactly, which are absolutely vital for preventing excessive bleeding when you experience an injury.
So this single organ is performing all these incredibly complex and vital tasks without most of us ever giving it a second thought. But what happens when things go wrong, when the liver becomes inflamed? That's where the topic of hepatitis comes in.
Precisely. Hepatitis simply refers to inflammation of the liver.
Huh.
Our source material details several different types, and it's really important to understand how they differ
Okay.
in terms of how they're transmitted and their potential consequences.
Okay, let's take them one by one. First, we have hepatitis A, or HAV. How does that typically spread?
Hepatitis A is primarily transmitted through what we call the fecal-oral route. Right. This means the virus is shed in the feces of an infected person and can then be ingested by someone else, often through contaminated food or water or through close personal contact.
And what are the usual signs and symptoms if someone contracts hepatitis A?
The onset is typically acute, meaning the symptoms develop relatively quickly. Individuals might experience flu-like symptoms, fatigue, nausea.
Oh, like the regular flu.
Yeah, kind of. And characteristically, jaundice, that yellowing of the skin and whites of the eyes due to the buildup of bilirubin in the blood.
Okay, the bilirubin again.
Exactly. The good news with hepatitis A is that in most cases, it's self-limiting. Your body's immune system is usually able to clear the virus on its own.
So generally, no long-term health issues with hepatitis A.
That's generally the case. Chronic infection or long-term complications from hepatitis A are quite rare.
Okay. Next up is hepatitis B, or HBV. How does that virus spread?
Hepatitis B is transmitted through direct contact with infected blood, semen, or other bodily fluids. Common ways it spreads include unprotected sexual contact, sharing needles or other drug injection equipment.
Right.
And from an infected mother to her baby during childbirth, this is what we refer to as perinatal transmission.
And what are the clinical features that might indicate a hepatitis B infection?
Individuals might develop jaundice and an enlarged liver, which is medically termed hepatomegaly.
Hepatomegaly, okay.
However, a key difference from hepatitis A is that hepatitis B can become a chronic, long-term infection in some people. This is a really important distinction to keep in mind.
And if hepatitis B does become chronic, what are the potential long-term health consequences?
Well, chronic hepatitis B can lead to significant liver damage over time, including the development of cirrhosis, that irreversible scarring we mentioned earlier.
Ah.
And it also significantly increases the risk of liver cancer, specifically a type called hepatocellular carcinoma.
Wow. That sounds considerably more serious. Now let's move on to hepatitis C, or HCV. What's the primary way this virus is transmitted?
Hepatitis C is primarily spread through direct blood-to-blood contact. In the past, blood transfusions were a significant risk factor, but with current screening practices, the most common route of transmission today is through the sharing of needles and other equipment used for intravenous drug use.
Okay. What are the initial signs or symptoms that might suggest someone has hepatitis C?
This is often what makes hepatitis C particularly challenging. It's frequently asymptomatic.
Asymptomatic, so no symptoms.
Right, meaning many people don't experience any noticeable symptoms until the liver damage has progressed significantly. This silent nature is a crucial difference from hepatitis A and often even from the early stages of hepatitis B.
So someone could potentially have hepatitis C for many years without even realizing it. And what are the potential complications if it becomes chronic?
Unfortunately, yes. Chronic hepatitis C is a leading cause of cirrhosis in hepatocellular carcinoma. Because it can remain silent for so long, individuals may not be diagnosed until they develop these very serious complications. This really highlights the importance of screening for those who are at higher risk.
That's quite concerning. What about hepatitis D, or HDV?
Hepatitis D is a somewhat unique virus. It's a helper virus.
Not helper virus.
Yeah, meaning it can only infect individuals who are already infected with hepatitis B. It essentially relies on the hepatitis B virus to be able to replicate within the body. So it's impossible to contract hepatitis D if you don't already have hepatitis B.
Interesting. And what happens when hepatitis D co-infects someone who has HBV?
It tends to make the hepatitis B infection much more severe and significantly increases the risk of developing acute liver failure. So for someone living with hepatitis B, getting a hepatitis D co-infection is a very serious health concern.
Okay. Finally, we have hepatitis E, or HEV. How is that one typically transmitted?
Similar to hepatitis A, hepatitis E is usually spread through the fecal-oral route, most commonly through drinking contaminated water.
And what are the typical clinical features of a hepatitis E infection?
It generally presents as an acute, self-limiting illness, again with symptoms like jaundice and flu-like malaise.
So similar to Hep A again.
Mostly, yes. However, there's a particularly significant concern with hepatitis E in women who are pregnant.
Oh. Why is that the case?
Hepatitis E infection during pregnancy can be unusually severe and carries a substantially higher risk of mortality for the pregnant woman compared to other populations. That's a really critical point to be aware of.
Wow. Okay. So just to summarize the key differences for our listeners, hepatitis A and E are generally acute infections spread through contaminated food or water and typically don't lead to chronic problems,
Right.
although hepatitis E can be very dangerous for pregnant women. On the other hand, hepatitis B, C, and D are primarily transmitted through blood or bodily fluids and have the potential to become chronic, leading to more serious liver damage.
Exactly. That's a really helpful way to understand the distinctions. The source material emphasizes this core difference. Hepatitis A and E are acute and spread via the fecal-oral route with no chronic disease in most cases, while hepatitis B, C, and D are bloodborne and can progress to chronic infection and potentially cirrhosis.
Got it.
That's the main takeaway to remember.
Okay, so if someone suspects they might be experiencing some sort of liver issue, what kind of diagnostic tests would a doctor typically order?
There are several diagnostic tests that can help determine if there's inflammation or damage occurring in the liver. A common starting point is a panel of blood tests known as liver function tests, or LFTs.
LFTs, okay.
These tests measure the levels of various enzymes and proteins produced by the liver, including alanine aminotransferase, ALT, aspartate aminotransferase, AST, and bilirubin.
Let's break those down a bit. What does an elevated ALT level in a blood test tell us?
ALT, or alanine aminotransferase, is an enzyme that's predominantly found in liver cells. When liver cells are damaged or injured, they release ART into the bloodstream, so elevated levels are generally a fairly specific indicator of liver cell damage.
So ALT means liver cells are hurt.
Pretty much, yeah.
Yeah.
Think of it as a marker specifically released by injured liver cells.
And what about AST, aspartate aminotransferase? How does that differ?
AST is another enzyme that's present in liver cells, but it's also found in other tissues throughout the body,
Right.
like muscle and the heart.
Oh, okay. Not just the liver then.
Right. So while elevated AST levels can suggest liver damage, it's not as specific to the liver as ALT. Doctors often look at the ratio between ALT and AST levels to get a more comprehensive picture of what might be happening.
And finally, bilirubin. We've already discussed that it's the buildup of this that causes jaundice. What do high bilirubin levels in a blood test signify in terms of liver function?
Elevated bilirubin levels in the blood indicate that the liver isn't effectively processing and eliminating bilirubin from the body.
Right.
This could be due to a problem with the liver cells themselves, preventing them from doing their job. Or it could indicate a blockage in the bile ducts, preventing the bilirubin from being excreted in bile. It's a clear sign that the liver's ability to handle this waste product is compromised.
Okay. So LFTs provide a general overview of liver health. Are there also specific tests that can identify which type of hepatitis virus might be involved?
Yes, absolutely. There are serologic markers, which are specific blood tests designed to detect antibodies or antigens related to the different hepatitis viruses.
Serologic markers.
Yeah. For instance, the presence of hepatitis B surface antigen, often abbreviated as HBsAg, in the blood indicates a current hepatitis B infection.
HBsAg means current Hep B.
Correct. And if HBsAg remains positive for more than 6 months, it suggests the infection has become chronic. Similarly, there are tests that look for anti-HCV antibodies, which indicate a past or present hepatitis C infection.
Anti-HCV for Hep C.
Right. And further testing to detect HCV RNA can confirm whether the infection is currently active.
That's really helpful to know that there are these specific indicators. Now, let's move on to what happens when the liver damage becomes more advanced and, unfortunately, irreversible. Cirrhosis. What exactly is cirrhosis in simple terms?
In essence, cirrhosis is the result of long-term chronic injury to the liver that leads to the replacement of healthy liver tissue with fibrosis, which is scarring.
Just scar tissue, basically.
Exactly. And as our source clearly states, this scarring is irreversible. Over time, this process disrupts the liver's normal structure and impairs its ability to function properly, eventually leading to liver failure.
And what are the most common underlying causes that can lead to this kind of irreversible liver damage?
Well, the causes of cirrhosis can vary. Here in the United States, the most common cause is alcoholic liver disease.
Okay.
However, on a global scale, chronic infections with hepatitis B and hepatitis C are major contributing factors. Other significant causes include non-alcoholic fatty liver disease, often referred to as NAFLD,
NAFLD, right.
autoimmune hepatitis, and various diseases that affect the bile ducts. It's interesting to note how the primary causes can differ depending on geographic location and lifestyle factors.
So it's a gradual process of damage over time that eventually culminates in cirrhosis. What are some of the clinical signs or symptoms that might suggest someone has developed cirrhosis?
There are several observable signs. Jaundice, again, due to the buildup of bilirubin, is a common finding.
Okay, jaundice again.
Ascites, which is the accumulation of fluid in the abdominal cavity, can occur because the damaged liver produces less albumin.
The albumin we talked about before.
Exactly, the protein that helps maintain fluid balance in the blood vessels. Think of albumin in your blood like tiny sponges that help hold water inside your blood vessels. When there's less albumin, the sponges can't hold as much water, and it leaks out into surrounding tissues.
We talked about albumin earlier and its role in fluid balance. So less albumin production by the damaged liver directly contributes to this fluid leakage.
Exactly. Then there are esophageal varices.
Varices.
Yes, varices. Swollen veins in the esophagus that develop due to increased pressure in the portal vein. Will delve into portal hypertension shortly.
Okay.
Hepatic encephalopathy is another serious manifestation where the buildup of toxins like ammonia in the bloodstream can affect brain function, leading to confusion and even a characteristic flapping tremor of the hands called asterixis.
Asterixis, that's a specific term. Can you describe what that looks like?
Asterixis is a neurological sign characterized by an involuntary, jerky, flapping movement of the hands when the wrist is extended.
Like they're flapping.
Yeah, as if you're trying to stop a bird from flying, kind of.
Yeah.
It's often observed in individuals with hepatic encephalopathy due to the elevated levels of ammonia affecting brain activity.
That's a very distinctive sign. What other physical manifestations might be present in someone with cirrhosis?
You might also see spider angiomas.
Baker.
Angiomas. They're small, spider-like networks of blood vessels visible just beneath the skin. And in men, gynecomastia, which is the enlargement of breast tissue. Both of these can occur due to the liver's impaired ability to metabolize hormones like estrogen, leading to a relative increase in their levels.
So a range of quite significant and noticeable symptoms can arise. How is cirrhosis actually diagnosed? Are there specific tests for confirming it?
Liver function tests will often show a certain pattern in cirrhosis, typically with elevated levels of ALT, AST, and bilirubin, but also a decrease in albumin levels.
Ah, the low albumin again.
Exactly, reflecting the liver's reduced ability to produce proteins. However, imaging studies such as ultrasound can be very helpful in visualizing the liver's structure and identifying signs of scarring.
Like seeing the damage.
Right, but the definitive diagnosis of cirrhosis usually requires a liver biopsy.
Say a biopsy.
Yeah, where a small sample of liver tissue is taken and examined under a microscope to look for the characteristic fibrosis and nodular changes.
Got it. And what are some of the really serious complications that can develop as a result of cirrhosis?
Well, we've already touched on several. Hepatic encephalopathy, with its associated confusion and asterixis, is a major concern. Ascites can become quite uncomfortable and can also increase the risk of infections.
Right.
Esophageal varices pose a significant risk of life-threatening bleeding if they rupture.
That sounds really dangerous.
It is. And unfortunately, cirrhosis, particularly when it's caused by chronic hepatitis B or C, dramatically increases the risk of developing liver cancer, specifically hepatocellular carcinoma.
You've mentioned portal hypertension a few times now. What exactly is that, and why is it such a significant consequence of cirrhosis?
Portal hypertension essentially refers to abnormally high blood pressure in the portal vein.
The portal vein.
Yes, which is the large blood vessel that carries blood from the digestive organs, the stomach, intestines to the liver for processing. In cirrhosis, the extensive scarring and fibrosis within the liver tissue obstruct the normal flow of blood through it.
Like a traffic jam.
Exactly like a traffic jam. This obstruction causes a backup of blood and a resulting increase in pressure within the entire portal venous system.
And this increased pressure in the portal vein is what leads to those other complications we've been discussing.
Precisely. The elevated pressure in the portal vein has several significant consequences. It causes the development of esophageal varices because the blood, unable to flow easily through the liver, gets diverted to smaller veins in the esophagus.
Ah, okay. That makes sense.
These smaller veins can then become dilated and fragile, making them prone to rupture and bleeding. Portal hypertension can also contribute to splenomegaly.
Splenomegaly. Enlarged spleen.
Yes, enlargement of the spleen. The enlarged spleen can then trap blood cells, leading to lower platelet counts and anemia. And it's also a major factor in the development of ascites, as the increased pressure in the portal vessels causes fluid to leak out into the abdominal cavity.
And there was one more visual sign you mentioned that's related to portal hypertension.
Yes, caput medusae.
Caput medusae, like Medusa's head.
Kind of, yeah. This is a less common, but quite visually striking sign. where the veins in the abdomen around the belly button become enlarged and visible. It happens because the increased pressure in the portal system causes blood to flow through these collateral veins near the surface of the abdomen.
Wow.
It can look somewhat like a head with radiating snakes.
Are there specific tests that can be done to check for the presence and severity of portal hypertension?
Yes, Doppler ultrasound is a non-invasive imaging technique that can be used to measure the pressure within the portal vein and assess the direction and speed of blood flow.
Okay.
In some cases, more invasive procedures might be necessary to directly measure the pressure.
Let's circle back to albumin for a moment. We understand that the liver produces it and that it's crucial for maintaining fluid balance within our blood vessels. Why is having low levels of albumin such a key factor in liver disease, particularly in cirrhosis?
Well, albumin is the most abundant protein in blood plasma, and one of its most vital roles is maintaining what we call oncotic pressure.
Oncotic pressure.
Think of oncotic pressure as the force that helps to draw fluid back into the blood vessels from the surrounding tissues. When the liver is damaged and produces less albumin, the concentration of this protein in the blood decreases,
Right.
and consequently, the oncotic pressure also drops. This reduction in oncotic pressure allows fluid to leak out of the blood vessels more easily and accumulate in the surrounding tissues.
Leading to the swelling.
Exactly, leading to the formation of ascites in the abdomen and edema, or swelling, in other parts of the body, like the legs and ankles. So low albumin isn't just a marker of liver damage. It actively contributes to some of the most significant complications of cirrhosis.
So low albumin is not just a symptom of liver damage. It directly contributes to some of these major complications like ascites. And I recall you mentioning that there's a simple blood test that can measure albumin levels.
That's absolutely correct. A serum albumin test is a standard blood test that measures the concentration of albumin in the blood. Low levels of serum albumin are a strong indicator of impaired liver function and are commonly seen in advanced liver diseases like cirrhosis.
Okay.
It's a valuable tool for both diagnosis and monitoring the progression of the disease.
This has been a truly comprehensive overview, understanding how the different hepatitis viruses can progress, the often silent nature of chronic liver disease, and the cascade of interconnected problems that can arise with cirrhosis and portal hypertension is quite eye-opening.
Yeah,
It really underscores how vital a healthy liver is to overall well-being.
indeed. And to help solidify these concepts for you, our source material included a really useful summary table. It neatly outlines the primary causes, common symptoms, potential complications, and the key differentiating factors for each of the conditions we've discussed today.
Well, that's handy.
Yeah, hepatitis A, B, C, cirrhosis, portal hypertension, and the state of low albumin. It provides a great way to visualize the connections and quickly recall the most important distinctions between these conditions.
Definitely a fantastic way to bring all the pieces together. So just to briefly recap for you the key takeaways from this deep dive. The liver is an incredibly versatile organ with essential roles in metabolism, detoxification, digestion, immunity, and blood clotting. Hepatitis, which is inflammation of the liver, can be caused by different viruses, each with unique transmission methods and potentials for leading to chronic infection and serious complications.
Right.
Irreversible scarring and fibrosis of the liver, known as cirrhosis, can result from chronic liver injury, leading to a wide range of clinical signs like jaundice and ascites, as well as dangerous complications such as variceal bleeding and an increased risk of liver cancer.
Yep.
Finally, understanding diagnostic markers like liver function tests and albumin levels is crucial for identifying and monitoring the health of this vital organ.
Precisely. And we sincerely hope this in-depth exploration has provided you with a much clearer understanding of the liver and the conditions that can affect it, all in a way that's, informative and accessible.
So as we bring this deep dive to a close, consider this. Your liver silently and tirelessly performs hundreds of critical functions every single second of your life, often without you even realizing it.
It really is amazing.
What does this incredible complexity and resilience of our bodies tell us? And how might a deeper appreciation for this constant, unseen work inspire us to take even better care of ourselves? It's certainly something profound to contemplate.